Thank you very much. Intermountain Healthcare is launching a brand new program for patients who need care from home. RN Rebecca Cooper-Knowles joins us today to talk about the program and what it will do for patients in need. Thank you for joining us. So Intermountain Healthcare has actually been offering home services since like the 80s, which probably you don't remember, but I certainly remember the 80s. Anyway, what's different this time around?
Yeah, so we're actually expanding the services that we offer at home to include more things like primary care in the home, palliative care for people who have chronic or very serious conditions, and even offering some hospital-based services and hospital-based care in the comfort of your own home.
So that brings me to my next question. What exactly, because obviously there are certain things you can't do. Also, doctor wants to roll in, $50,000 worth of equipment. What are the services that are being offered?
Yeah, so primary care, so face-to-face visits. Some of that will be done through telepresence with remote monitoring, and some of it will be done in person with a nurse practitioner or physician assistant or even a physician who could come to your home. Some of the services are also going to be for hospital type care, and those would be the lower acuity conditions where it's a less serious condition, but it's still something that requires a lot of monitoring, and that could be done in the comfort of your own room with your own family members right around you.
Now, I read somewhere, and I think I'm quoting you actually, that I read you made some comment about it reducing complications and cutting the overall cost of care. So are there some numbers that you can associate with that, or the amount of savings?
Well, I think for most people, we've seen that some of the savings can be up to 30%, less than what you would experience in a hospital setting or even in a clinic type setting. Today we even offer some of those immediate care visits for a very low price point at about $49 per visit with Connect Care.
And why is it save them money? And I mean, and I'm just asking questions because someone said, well, I can just jump in the car, or I can go get my mom and take my mom over to the doctor or wherever. How is it saving them money?
Well, first off, it's not just about saving money. It's also about what's convenient and works best for you or your family. And we know it's really hard to get sometimes a family member who's very sick to a clinic setting or even to a hospital. So in those situations, it's not just a money savings, but it's also a convenience factor. But from what makes it less is the fact that we're not putting all the facility services and the facility costs. You're just doing it in the comfort of your own home where none of those costs are associated with that.
And is it just the way that we're going? I mean, and I don't mean to compare it, but I do because people can relate to it. You can now call your favorite grocery store and get it delivered, or you can just pick it up and keep going. Is that just the way we're going even with medical care now?
Well, I think there's definitely something to be said for that. We didn't used to have the technology that we have today that enables us to do some of that remote monitoring and some of the telepresence type care. But also there's the measure of things are changing and it's a new world.
Yeah, if you don't just want to get online and just take whatever someone else writes, it is to interface with somebody like that. Now, where can people learn more about it? The websites and things like that?
Yeah, for sure. I think one of the best things to do would be to talk with your primary care provider about, is this service appropriate for you and your health condition? The other way to learn more information is to look at intermountainhealthcare.org. We have lots of information on our webpage about the services that are offered and how you can access them.
All right. Well, thank you very much for sharing that with us, Rebecca.